Welcome to the Dallas Duo Podcast,
your weekly wellness coffee date.
We're friends in Dallas, always looking for the best ways to optimize our health
and have fun along the way.
Welcome back to the Dallas Duo Podcast. Today, we're honored to be joined by Dr. Meredith Abbott, a board-certified ophthalmologist and fellowship-trained oculofacial plastic surgeon based in Dallas. Dr. Abbott founded her boutique practice, Abbott Aesthetics, to combine advanced eyelid surgery, reconstructive procedures, and non-surgical rejuvenation in a luxurious patient-centered setting.
Her work casts light on both the functional and artistic sides of restoring vision, confidence, and natural beauty. We can't wait to dive in and learn from her expertise in vision. Welcome to the podcast, Dr. Abbott.
Thank you. So happy to be here, and thanks for the invite.
Yes, well, we'd love to know what inspired you to pursue medicine and specifically oculofacial plastic surgery.
I think medicine was always in the cards for me, even when I was really young. I mean, I remember when I was 6 years old, I always wanted to be a doctor. I loved science. I loved biology. I loved taking care of people. I would have my clinics, and then my brother play, little doctor's office at home all the time. So all of my family members and friends have all been my patients from the time I was 6. It was always what I wanted to do. There was, never another option for me. It was just very focused on that. It was probably in college where I became interested in ophthalmology in particular, because my grandmother developed really severe macular degeneration. And I saw how that affected her life so much. So she went from being super functional driving to almost overnight, not being able to drive, and really depending on everyone around her for so many things. And just the impact that had just, it really hit me. And so then when I went on to medical school, first 2 years are mostly just science and your anatomy and your physiology and your microbiology, pathology, all of that stuff. But then starting in 3rd year, when you start doing rotations, is when you can really focus and do elective rotations in certain fields. So at that point, I did ophthalmology and both private practice rotation, and then also the academic one, at my school, and then, a couple of way rotations as well. And I just loved ophthalmology. So I was very thankful to be accepted into my first choice of ophthalmology residency at UT Southwestern. And it was during that time so then when you're in your residency program, of course, ophthalmology is now so subspecialized that we have cornea, retina, glaucoma, uveitis, ocular pathology, and oculoplastics. And there's so many things. Or you could do general ophthalmology, which is amazing too. But it was during that time that I was exposed to oculoplastics, and I realized just how much I loved it. I loved being in the OR. Anytime that I had a free minute, I would stick my head in the oculoplastic clinic or OR and just, do as much of it as I could. So, and then I interviewed for that and ended up at the New York Eye and Ear Infirmary in Manhattan, and have just truly amazing mentors that were just such wonderful people and, role models, wonderful surgeons, but also just, the type of people you aspire to be and aspire to be with, just very solid all around. And, I feel like that really shaped who I am today.
Yeah, mentorship is such an incredible tool, I think, as you're finding your way in practice. I think that early on when you're in a field, there were certain professions that I met that I would be driven away from because of the personality type or the way that they worked with patients, right? It really aligns that you aspire to be, like your mentor. So you want to know their bedside manner, the patient outcomes, how you're affecting people's quality of life by the care that you provide.
Exactly. One of the most important things that my mentors told me was not even, medical. It was just listen to your patients. David De La Rocca, the son of Robert De La Rocca, who was my senior mentor, so his father and son, one time he told me, sometimes you just have to listen. Patients need to feel heard, whether it is the first time you meet them and they're telling you about what's going on, but you shouldn't make any assumptions of what they want or how they feel before or after surgery or any type of treatment. You really do need to listen.
Can you, just for listeners who don't know the difference, can you explain how oculofacial plastic surgery would be different than general plastic surgery and what they would see you for versus a general plastic surgeon?
Sure. So, it's basically just, more focused. So anyone that does oculoplastics or oculofacial plastics are kind of like used interchangeably in terms of those terminology. But we are required to do ophthalmology first. So you do the full ophthalmology residency. So you do your 4 years of medical school, and then everyone has to do 1 year general internship, medicine, surgery, or transitional, where you kind of rotate through a bunch of different things as a general intern. And then you have to go on and do your 3 years of ophthalmology. And then you can finish and be a general ophthalmologist, which is a great path. Or you can choose to do a fellowship, which is what I did. So it's just a different training route. And I think the reason it's important is because obviously it's such a vital organ. And even though I didn't end up doing retina, that definitely wasn't in the cards for me. I was not really that drawn to the retina surgery and clinic and everything once I was exposed to it more. But I still, everything about the eyelids, the eyelids support the eyes. And if your eyelids are unhealthy, it can be devastating. It can cause horrible dry eye. It could cause blindness. There are certain diseases like autoimmune disease and also even infectious diseases that can cause scarring between the lids and the eyeball. And, it's devastating. Or even like burn victims, during residency at Parkland, we would round in the burn ICU, which is, actually we have this wonderful unit here, thankfully. You just kind of see what these types of injuries can do to the tissues around. And even if the eye is not initially affected, if the eyelids are affected, your eyes are not going to function. And you could end up losing your eyes, actually, just because of that. So I think just understanding the role that the eyelids have so intimately is super important in what we do. Even if we're doing aesthetic surgery, it's having that background in the function of the eyelids and also knowing how to examine the eye. So I have full eye exam equipment in my office, so I can do a slit lamp exam, look at the surface, stain for any dry spots, any scratches, if someone has a corneal abrasion, check pressures. I can dilate the eyes, look at the back, because usually I don't have to do that. But every once in a while, it may be possible that someone's blurry and I need to be able to fully evaluate it.
I think it's so interesting that you bring up eyelid health, because I feel like that's something that a lot of people probably don't know much about or have really thought about. What's something that people may not know that you can do just in your everyday life to keep your eyelids healthy?
I mean, in general, I would say just, don't use any harsh products on your eyelids. Like that skin, that tissue is so delicate and thin. So that, on the rest of our face, we have, the dermis and the adnexa is full of fatty tissue and oil glands and all of these things that make the skin and the tissue thicker and able to sort of heal quicker from any injuries or wounds. The eyelids, as you can kind of see and feel, are so thin that it's one thin layer of epithelium, and then right underneath it is your orbicularis muscle. So it's the muscle that helps you close your eyes, and there's no fatty tissue in between. Just goes straight from the skin to the muscle. And so it can't take all the harsh products that you might use on the rest of your face. And so that's one thing. And then it was funny that you bring that up, because a good friend of mine just texted me a couple days ago. She was like, "Hey, my eyelids are driving me crazy. They're like red and swollen and itchy. I can't stop trying." She put Neosporin on them. I don't know, all this stuff. And I was like, first of all, stop all of that. That's not for your eyelids. I think she did have one ophthalmic ointment that was antibiotic. That wasn't hurting it, but it wasn't an infection that she had. And so, I had her send me photos and we kind of discussed what was going on. And she was basically having atopic dermatitis, sort of like eczema on your eyelids. So that's something that, I see not that infrequently. And you might use a topical steroid elsewhere in your body, but typically for that, I don't like steroids. On the eyelids, I kind of use a different cream. So this person is also a patient. So I was like, look, I'll send it to your pharmacy, this other treatment. And And I actually saw her yesterday at my son's flag football game, and she said, "That cream was magic. Like, you saved my life." So, there's like little things like that. Sometimes it's just the eyelids are different. Um, so kind of need to be handled in different ways sometimes.
I think this is really good that you point this out because a lot of what we see on the podcast is like talking about the importance of working with a provider who works within a certain scope. Like your OB might not be able to help you with perimenopause, or like your dermatologist might not be able to help with your eyelids. Like finding the right provider that knows how to care for you appropriately is really important because, like you're saying, you work with such a specialized, delicate tissue and have so much specialized training in that area that if I was having an eyelid issue, I would never go to my general practitioner, like I would be concerned
Right.
about what the provision would be in that care because there is such specialized resources now. So I think this is good for people listening to know, like, if you're having eyelid issues, you need to be careful what you use and who you ask because it is so delicate.
Right. Agreed. And oculoplastics is a pretty small field. There's not a ton of us because we're so focused and specialized.
I've been a patient and client of yours, and so I've been fortunate to, visit your beautiful location in Dallas. What motivated you to create Abbott Aesthetics as your boutique practice in Dallas?
So that's been a really fun journey. And actually now like celebrating 4 years of being open. So we have a big anniversary party coming up on May the 7th and everyone's invited. So come join us. It's May the 7th from like 11:30 to 3:30, but stop in anytime. I was in a really wonderful group practice for almost 10 years before that. So after I graduated from my fellowship, I knew who I wanted to work with and I had a wonderful experience. I really loved the other physicians that I work with and it was really great. I wouldn't change that for the world. I did get to a point though where I kind of wanted something a little bit more personalized in terms of, what I could provide for my patients. So in addition to the surgery, I wanted to be able to provide laser resurfacing around the eyes, just so, can kind of complete the whole picture so we could treat that skin. Because imagine if you have really droopy upper lids and maybe big bags on the lower lids. Surgically, I can make that look a lot better. But if that canvas is, not damaged, you can only do so much with surgery. So that was one of my major motivations, as well as being able to spend more time with my patients. So I just really wanted it to be more of a concierge type approach where I could really just have like longer appointment times than I did previously. And I was at a point in my life and career that, my husband gave me the support and said, okay, go for it. So
That's awesome. Well, and it's interesting that you mentioned you can do an eyelid surgery and have improvement in how it looks. You still want to focus on this quality of the skin and the condition of the skin. It's really interesting that you're able to combine those two things in your practice.
It's a more holistic approach, right?
Right. It's a more holistic approach. And in addition to that, we also treat the whole face. So often, if people need laser resurfacing of the eyelids, not everyone does, but if they do, often the rest of the face, I'm like, okay, we need to blend this. I do not want anyone having like perfect skin around the eyes and then blending into something that's, not so perfect. I shouldn't use the word perfect, by the way, but let's say improved, pretty healthy canvas, right? So we don't want to have raccoon eyes. So we always, combine the periocular laser with full face and neck laser as well. And often that's a different treatment, but just customized based on what the patient needs, just to help with the blending and overall result. In terms of like being holistic and everything, we also was really encourage like good nutrition and having a good functional medicine provider. One of my favorite things to do has nothing to do with my practice, but I love providing patients with connecting them with providers that they might be, good for what they're going through. And just having that network of other physicians and providers has been really critical, in our patient success. Because if they're not healthy on the inside, they're not going to be healthy on the outside.
You say that has nothing to do with your practice, but I would say that that's actually like, as a dietitian, that's like my strongest benefit is patients know when they come to me that they will be connected with all of the critical other care units that they need to succeed. And I think that comes from working in the ICU, like understanding the importance of collaborative care. And like you know that if all those other pieces aren't taken care of, it's not going to work. Like there's a domino effect in the body, and it is so integrative is that, if they're seeing you regularly and being compliant, but they're ignoring everything else, it's eventually not going to turn out to the best optimal results that they could have. So I think that that's like one of your
Exactly.
best strong suits is when you are a provider that's like, oh, I know
Right.
all the best people that I'm going to refer you to. You think patients appreciate that so much.
Absolutely. Yes. I take pride in that. And it's super important for me. And a lot of times people, sometimes someone has just moved here and has no idea who to go to. And so that's super fun to like set them up with all the things. But, a lot of times it's someone that's lived here forever and they just don't know who to go to, whether it be with perimenopausal women and menopausal and postmenopausal women, but also just general health. I think that general internal medicine doctors, they only have so much time allotted for their patient encounters, so they don't necessarily always have time to go dive deep into all of the nutrition and stuff like that you would do or a functional medicine provider. So it's a lot of fun to do that. And definitely that's how you see real results and make people feel better.
Well, and as a patient, I'm always so thankful whenever one of my providers has a good referral for me in another area where I need help. So I think that's a great resource. What are some of the most common procedures that you perform?
Surgery wise, it's often, upper eyelid blepharoplasty, lower eyelid blepharoplasty, often combined. And for some patients, it might be just one or the other, depending on their needs. The other thing that we do a lot in the office is for patients that don't need lower surgical bleph is upper eyelid blepharoplasty combined with lower lid laser resurfacing. And then, like I'd mentioned before, doing that combined with a full face and neck laser, such as BBL and Halo or BBL Moxie or Profractional. But that's always super fun. And we've got everyone in the office involved. And it's sort of like a fun half day for us and the patient. So that usually they're there for about 3+ hours when they do all of that together. I have just the best staff I could ever really dream of, and they make the patient feel so comfortable and take away all of their anxiety and help me make that comfortable for them.
You do have such a warm and welcoming environment in your office. I can say that from experiences. I think you really make people feel comfortable there. For someone considering eyelid surgery, what's important to know before taking that step?
The most important thing is really just to have a very, thorough consultation, education about it, making sure there's enough tissue, that your eyes are healthy enough to undergo the procedure. I think it really all goes down to that patient education. There's not necessarily a single thing. Sometimes people ask me if they're too young or too old, and I would say age doesn't necessarily matter. I mean, there can be too young, but we have that talk if that comes up. But typically it's more about, is the patient, first of all, do they actually have the findings that warrant surgery? They need to have enough skin. It's more about what skin I leave behind than what skin I take. And so marking at the beginning of the surgery is super important. But it's all in terms of patient selection. Again, it's not just age, it's about health. Are they healthy enough to undergo a procedure? Are they also mentally and emotionally mature, right? So we could have people of all ages that might not be. So we try to figure that out ahead of time.
This field is super new to me, not ophthalmology, but the surgical side. What percentage would you say of procedures is done from like a purely aesthetic goal?
That's hard because I feel like they work together. Like the, aesthetics and the function work
Functionality.
together. They're like hand in hand. So, I mean, there are times that the lids are completely blocking the pupils and the patient can't see because their peripheral vision is affected. That is really not aesthetic at all. But I have to say, even if Medicare insurance is completely covering it, it's like that's still an aesthetic surgery. So whether it's really should just be functional, it's always some aesthetic. Of course, they still care about their result. The eyes are the first thing you see. When you're talking to someone, you look into their eyes. The aesthetics is always a part of it. Even if it's a reconstructive case, let's say you have a big basal cell carcinoma on your eyelid that needs to be completely removed and you have to have your lids reconstructed. The aesthetics still matter, right? Because that patient, their confidence and everything, are huge, and they want to feel like they want to feel normal. I think that they're always intertwined. And let's say also a patient comes in and they just want, aesthetic eyelid surgery, which is the majority of my patients. The function is 100% important on every single one of them. So I would say that 100% of my patients have or need both.
Feel like this is a really good distinction because we talk a lot about like patients who might just go to like a med spa for a treatment, say like a Botox or something, but they don't have a provider who understands how that is going to affect their structure of their face, maybe long term. And so then 10 years later, they might have like another issue because of muscle weakening that wasn't addressed with an expert. And so I think it's so important that you do talk about function and aesthetic benefit because you do want a healthy body and you also want it to look good.
Exactly. And maintaining, the natural form, goes hand in hand with the function of, our eyelids, but also the rest of our face and body. It's really important to be in the right mindset.
I think you see a lot of like upper bleph. I don't know that it's gained in popularity, but I feel like it's something you see more like on social media or in the news talking about celebrities. Are there other things that you can do that maybe aren't as invasive as that can improve the look and health of your eyelids aesthetically? Or would you say if you're really looking for a big improvement, that would be the thing?
For upper eyelids, you need a blepharoplasty. I don't want to say it's not a big deal because it's still surgery, but it's not a major deal. Like if you're a good candidate, we do it in the office with no anesthesia besides local all the time.
Okay.
95% of my patients that have upper blepharoplasty alone, not combined with lowers, are now done in the office. And I don't do any type of IV anesthesia. If it's just upper bleph, it's like 1 hour.
Oh, wow. Okay, I didn't know that. Well, yeah. And of course, I'm like asking for a friend.
Book it for an hour and a half to include time for like marking and any last minute questions and numbing. The surgery takes an hour.
What's recovery time look like?
It looks a little different for every patient in terms of how much bruising and swelling they have. But my patients that are kind of really on top of it have very little. And that includes, going through all of their medications, including the supplements. People are on so many supplements. And sometimes I look at these things and I'm like, okay, what about your protein powder or whatever, this or that? And they're like, oh yeah. And then they send us a picture and I'm like, first of all, you're like triple dipping on this one, nutrient. Like, I don't think that's necessary to have 10,000% daily value. Some patients are on like nothing. And I'm like, great, that's easy. And I'm not against supplements. I take supplements, but there are certain things that do need to be stopped. And anything that says like proprietary blend, well, what is in that? We don't know because it's proprietary. Well, got to stop it. I do find that if people are like really honest about what they're on, stopping all those things for about 2 weeks beforehand makes a huge difference. And then in addition to that, we give the patients these Swiss therapy masks to use afterwards. I've been using those eye masks for like 15 years on my post-op patients, but using those like pretty frequently in the first 3 days makes a huge difference. So I'd say, look, put your time in for that first 3 days and you're going to notice at 1 week that you barely have any bruising and swelling.
Wow.
And so for most patients, that's really true. But again, there's always outliers or people that maybe on something that didn't even realize that. So at 1 week, we take the stitches out. And then for that second week, I always tell the patients, look, your stitches are out. I know you're feeling really good. Don't overdo it. So go to your meetings, read your email. You can work a full day. That's totally fine. But no exercise and no eyeshadow or upper lid makeup during that second week. And then at the 2 week mark, you can do full makeup, full exercise, like you're sort of released to kind of do full activity. So I always say 2 weeks in general is a good amount of downtime, but that doesn't mean that you're locked up at home for 2 weeks.
It's something that I've definitely researched because I feel like it's one of those procedures that makes a really big impact, on just the overall look of your eyes. And, of course, as we get older, we tend to have a little bit more volume in the eyelids. And with Botox, you can only lift so much.
You can only do so much with that. Exactly. Yeah, exactly. And then sometimes, of course, when you're treating the forehead with Botox, it can
You could
actually
to lower, which is even worse. And you provide those services. So again, going to someone who, has that knowledge of that specific area of the body, of the face is so important.
I would say like my practice has really shifted in the last, 5 to 6 years. I'm really seeing so many more, younger patients that are kind of just wanting to benefit from the surgery. Maybe they saw their parent or their aunt or uncle or their, grandparents wait until they were in their 60s or 70s. And they're kind of like, am I too early? Or like, this is really bothering me. Is this ridiculous? Or what do you think? And so we kind of go through all the things. And a lot of times people are like, oh my gosh, that was so easy. I should have done this a long time ago. But so it is a pretty straightforward procedure. But it is still surgery. So we have a very long conversation about that. And so everyone's on the same page. But yeah, it's a pretty enjoyable experience. Most people say like, I really have to credit my staff for that and just for making that experience so nice.
What are some of the other common procedures or services that you offer in your practice?
So, in addition to all the different laser services, which I'm very, very selective about which technology I purchased, I love Cyton. Their BBL phototherapy there's like one thing that you were going to invest in for your skin, I would say BBL. There's science behind it. There's been Stanford studies showing that it improves the health of your skin. And it's just amazing. So I have two different machines that do BBL Hero and then BBL Heroic. So the kind of latest in BBL technology, we have all of that. And we recently added a vascular suite called Clear V. And there's Clear V and there's Clear Silk. This is something I feel like I'm like having a midlife crisis and just keep buying lasers. I'm like, oh my gosh. But I am a little bit obsessed with the technology, and the company is really solid with their R&D. So I trust it, and I've just seen such amazing results. But, with the Clear V, I can now treat those like dark I actually have one over here. I need my nurse to do mine. Usually those like big periorbital veins. Usually with this laser, I'm able to treat it in one treatment. And there's like no numbing. I put a little ultrasound gel on and then some eye protectors, and it's so cool. And that you can also treat other facial vessels with the Clear V and leg veins and yes, so that's fun. And then Clear Silk has been something that I didn't even know I wanted or needed, but it kind of came with my Clear V. And that has been an amazing, like, no downtime treatment for the things that it most helps with is just rosacea and underlying redness, like flushing, blushing, people that like suffer with that it's so common. So many people have that, and it's a super quick treatment, no numbing, no downtime. And so it's been really great, and it's inexpensive too. So that's also obviously nice. So, and patient
that's the laser that helps with like the issues with redness. So like you said, rosacea or that type of pigmenting.
You're like redness, and it kind of helps with the the underlying cause of, the redness, which we can also use BBL to treat, by the way. But the Clear Silk has a more specific wavelength that targets that even more selectively. So it's been very cool and fun to have that.
So would you recommend, like, bang for your buck, doing a series of one of the BBL lasers like once a year? Or what would you recommend, say, for someone in their 40s or in their 30s?
Yeah. I would say, part of that is going to depend on skin type.
Okay.
And also what the issues are going on. But for most skin types, I'm going to say BBL, and I mean, for the patients that can do it, doing like a quarterly BBL is amazing. There are some skin types that cannot really have BBL. So Clear Silk is going to be a good option if you really suffer with that underlying redness, or Moxie is another option for people that's suffer with stubborn pigment, and that's safe for all skin types as well, which is really nice. So you do that year round. You do that with patients with melasma. So it kind of like depends on a few little things like that. So we give all of our patients a consult. In general, we have to kind of like clear that ahead of time. So they have to send us photos, and then they have to arrive a little early so we can go through all the things and get the appropriate photos, because we want to make sure that our patients are getting the right treatment. There's a lot out there. Right, because that might not be the best use of their money or the best use of their time or the best thing for their skin. There are certain things that are kind of good for everyone, like a Moxie or a Clear Silk, so I worry less about those. We love to really educate our patients and make sure that they're getting very customized treatments for exactly what they need.
As a patient, personally, like I would want to come in for a consult and say, these are my issues. What would you recommend? And then go from there with the personalized plan. And it sounds like you do a lot of that too.
Yes, we do. We can do like kind of like a year round like goals and plans for the patients that can do that. And a lot of that also will include skincare. And we want to keep your skincare simple and doable and something you're going to be able to keep up with.
What are the essentials or like the must-haves for women that are in their late 30s to 40s? What would you say are like the skincare absolute must-haves?
Obviously, sunscreen. And it's kind of a generic answer, but it is so true. If there's just one thing, you have to have good sunscreen that you like and that you're going to be consistent with. So all of those things are super important. You need to be able to reapply it. I feel like a broken record sometimes telling people, I know you put your sunscreen on this morning, but when you get home from work and you want to go walk your dog or go to your son's soccer game, you need to reapply, and you need to be wearing a hat as well for that extra physical protection. That's just a no-brainer, and it is so, so, so important. But in addition to that, just really, really good hydration. There's 2 different products that I love for just hydration, and, which is a little different than like a moisturizer, right? So I know I want something that hydrates, that like really goes into my skin after I cleanse. And I kind of alternate between an LBH alpha hydroxy cleanser and the Elastin gentle cleanser. Or extra calm cleanser. But then with the Clean Skin Club towels, by the way, if you haven't ever tried those, I am so obsessed. I tried them last summer when we were traveling.
They're so good. And it's funny because like that's one of the things that my daughter, she's like, Mom, we need to get these. And of course,
they're so great. So now we carry those just because I'm completely obsessed. I feel like my skin is cleaner and I can tell when everything's off. And they don't have any product on it. So it's just you put your cleanser and your water on there, like the Neutrogena wax and stuff, do not recommend. But so those are great. And then I immediately follow that with serum. So I love the Epicurious lipid serum. It's super hydrating, and the LBH prickly pear seed oil. So I usually do one or the other, and then I let that soak in. So that's the other thing that I think giving your product time to really penetrate is so important. If you slap everything on at the same time, it's just not going to be as effective. And then I put my moisturizer on after that to lock everything in. And then in the morning, my sunscreen and sometimes mascara and lips make it on, and sometimes they don't. But I don't wear foundation. No one in my office wears foundation. And we highly like our goal for all of our patients is to wear no makeup. Just, no foundation at least. We want your skin to be so healthy and glowing that you feel good in it. It's just your sunscreen. And they have some great tinted sunscreens, that give you a little bit of coverage now. So, we don't want you to be covering everything up. It's also very occlusive, some of those foundations.
So just to backtrack, what was the moisturizer that you recommended, or is there one that you recommend? And the tinted sunscreen too. I'm dying to know. I don't like a lot of foundation or heavy foundation, so would love to know what you like.
I love the Elastin Ultra Nourishing Moisturizer. That's like my favorite day and night moisturizer for if people need like a heavier night cream. The Epicurious Hybia cream is fabulous. I'm usually fine with the elastin. It's still like very nourishing, both morning and night. So, and then their tinted moisturizer, it's their elastin hydro tint. I just think it has a beautiful, beautiful coverage. It's just one shade, and so I'm pretty fair. You have to like really like rub it in, but it's not too thick, and I feel like it just like if you rub it in, like it just is really nice and pretty. Has a good finish. I don't know if this is still a thing. Everyone used to wear that Elta MD like UV clear, the tinted one. I don't love that, but I do have some other Elta MD products that I do love, and I am very picky.
You deal with it every day, so that's why I'm asking. I would love to know what you love.
So the Elta MD, they came out with it probably a year ago. It's called UV recovery, and you can use it anytime. I mean, it's general enough to use after a procedure, but it's all mineral, and they have one that's green that's sort of like a redness corrector. So patients love that. That tends to sell out super fast for us. And then the one clear one, and that's my favorite non-tinted mineral sunscreen. Love, love, love that one. Also, they have like a spray that's all mineral now from Elta that we carry, and that actually rubs in clear. And then a sunscreen stick that I'm trying to be better about using that on my hands, because I feel like my hands are old because I'm washing them a million times a day. And then you're driving, and it's it's easy to forget. So I like this stick for that, because like I just will grab it and like put it on the back of my hands and my fingers. And then my kid, and then like I'll pass it back to my kids and they'll put it on their face, in the summers. Yeah. So we just, I try to carry a curated collection of products, because if you look online at Elta, they have 50 sunscreens or something. And I think some are better than others. But yeah, the Elastin Hydro Tint, though, is a really pretty tinted one with nice coverage.
I haven't tried that one. I'll have to look into that. You mentioned like, in the afternoon, if you're going to go back out for a walk or be outside at kids' games and stuff, do you recommend any of the powders? Like, what do you think about those for that specific time?
I love the idea of them. However, I always worry that with the powders, you might not get good coverage. I feel like it kind of disperses. And so I have shied away from those just because of that, because I can't tell where it's really going. So that's when I grab my Elta UV recovery, because it's clear. And even if I have the green one, like that also goes on clear, but I'm not worried about rubbing in my makeup, right, with the tinted one. So I use that, and it's really moisturizing. So usually at that time of day, I'm kind of like, I don't care. Like my other like Hydro Tint is probably not really giving me that much coverage anyway, and I'm getting older, so I feel like my skin is getting drier. So I like the consistency of that UV recovery. To me, it feels like I'm putting on moisturizer. Yeah. So there are times in the morning too that I put that on instead of moisturizer if I don't have time for that extra step.
Okay.
Because it's really nourishing.
Okay, that's good to know. Yeah, because as we get older, our skin does feel drier, and so it's nice to have a little moisture boost.
So I'm not saying I'm against the powders, but when I really think about it, and I haven't looked to see if there's any like scientific papers on this, or studies. I don't know if anyone's done that work. Skin Better makes a really nice compact. That's a cream compact, and it has really good coverage, and that comes in both clear and tinted. So actually, that's a wonderful product for that, in terms of having it in your handbag and it not spilling.
Okay, that would be a good
My
solution.
brother used to use the clear one, which is really funny, but because he liked the way it went on, but finally it was like, okay, he's going to kill me when he listens to this, but I don't care. We'll get over it. But he was like, okay, people are giving me weird looks if I'm like putting this on in my car, before I go to the golf course or whatever.
It looks like makeup. That's so funny.
Does it look? So I think he switched to the sunscreen stick, but he likes the consistency of the other one better.
Well, you live a very busy and active lifestyle. How do you find a balance? And again, that's always relative, but how do you find a balance in your life as a physician and a mom?
One thing that I've learned is that the balance is always changing. Like what my kids needed when they were babies and toddlers is very different from what they need now. But they still really need me. And I put them first, put them first and my patients first. And there are times that I'm at home, at night or the weekend, and I need to answer a patient on something, and they have to understand that. Sometimes they're like, Mommy, you need to get another doctor with you. So it's a balance, and it's never going to be perfect. But I think at the end of the day, I'm a better mom because of what I do. And I love what I do. So I think no matter what it is, whether it's like fitness or medicine or law, I think it's so important to have that passion. And if you ever feel like you're starting to lose that or I was getting really kind of worn out in my old practice. Like I loved it, but there was like a lot of guilt both ways, not from anyone else, just self-imposed. But I just, that's hard. You have to be self-aware and really take a look. And so now I'm like, okay, well, I could be making a lot more money if I did things a different way. But at the end of the day, my kids are only going to be this little once. And I like to pick them up from school sometimes. I like to be at their games and I like to take them to school and be involved in their school. I like to volunteer. That is the other thing I had to decide, many years back is that I'm sort of like a yes person. And so if someone asked me to take on some type of volunteer role, I used to just always say yes. And I had to take a step back and say, look, I'm only going to try to like focus on things that are involved with my kids.
Yeah. Having some boundaries and what you can say yes to, I think is always so important. And so it's like really important for our kids to see us like, passionate about something and working hard towards something and, giving back. And so I think it's important for them to see that side of us as well. All the things you said are really important when it comes to that balance of career and motherhood. Is there any advice that you would give to women pursuing careers in medicine or entrepreneurship? I mean, you're doing both, so
Yeah, I'm kind of crazy, but I think more than anything, do what you love. If you're really passionate about something and that's something that you are meant to do, listen to yourself,
Mhm.
and go for it. It's still a male-dominated world, and there are so many more women entrepreneurs, physicians, lawyers. I mean, so many professionals. But it's still a male-dominated world, and you just have to be your own advocate, and sometimes that's hard because, being a female, you don't wanna be, like, looked at as, like, a bitch, right? Like, I mean, I don't like to say that word. I'm like, "That doesn't even feel right saying that," but you know what I mean? Like, you don't wanna
Yeah.
be that person.
But you want to still be able to advocate for yourself and speak up when you need to. So yeah, it's like I see what you're saying.
It's hard, like, I mean, I'm sort of a pleaser. I mean, I am a pleaser, for sure. So it's hard when you're a pleaser and someone says, "Oh, is this what you mean?" Da, 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 da. I'm like, "Yes," even though you might be like, "No, that's not really what I wanna do or what I want." So, I think at the end of the day, that was, a lot of why I was like, "I need to just do this my way," because we all wanted different things, in my other practice, and, it just being able to do it and I don't have to, like, answer to anyone is kinda nice.
Yeah.
But yeah, I think for women trying to step out and do whatever it is that they, are interested in is just being your own advocate and surrounding yourself with other women because we have such an amazing, strong community of women who want to support each other.
That's something that Whitney and I talk about a lot is that we're really fortunate that in Dallas there is just a really great community of women who are willing to support each other, mentor each other, and there's just a good network in our community. So we're really lucky to have that.
Yes, there really is. In my field, there's a lot of, or not oculoplastics, but in the aesthetic industry, there's a lot of people in it. But it's sort of like, you know what? There's room for everyone. It's better to just be welcoming and supportive of all of those people around us and not look at them as competitors, but friends. Because we all do better when we try to have that in mind.
Absolutely. Well, before we wrap up, we always like to do just some fun rapid fire questions. What is your must have skin product?
If I only had one thing, I would just have to say probably my like UV recovery sunscreen. The other thing is the LBH lip balm that, our esthetician developed. It's such a game changer. This stuff is just super nourishing, just the right thickness. It's nourishing. Really love this product.
Yeah, well, when you introduced me to LBH, and I really love their cleanser, the AHA cleanser,
AHA? Mm-hmm.
the toner, and the face oil, and I
Yes.
really have enjoyed those.
I
That's
love this
that's
product.
another question I forgot to ask you though. Tell us about the esthetician you have in house because
Yeah.
I think that's also another important
Yeah.
thing that you offer?
So Heather has been in the industry for over 25 years, started developing her own product line 5 or 6 years ago. And really, it's because she saw a need in the market for that. So she's usually in her office on Thursdays and sometimes can come on other days if needed. But a lot of what she's so good at is educating patients, and her products are simple, doable. They don't have junk in them. So they're pure. So it's just sort of like what you eat. It's important to have pure ingredients, simple food with good ingredients. What you put on your face matters, and it is absorbed into your body. And it's important to get, really simple, like good ingredients in your skincare.
Yeah.
So,
And it's really great that you carry them at Abbott Aesthetics. So LBH products, you can buy them. You can also buy them online, right?
I think so. And she has a few other retailers that she's working with.
Okay, so favorite way to recharge outside of work?
I would say really just love being outside. So walking my dogs, being outside with my kids, that more than anything. I love being outside in nature. And then mahjong with my friends is always fun too.
Before we go, what is next for Abbott Aesthetics? Is there anything coming up? You said you have your anniversary event. Anything you want to share with our listeners?
We have our anniversary event coming up on May the 7th, and everyone's invited. And we do raffles. We have a lot of support from our different reps. So it's always fun. And, people are always surprised when they win something. They're like, I never win. But we have a lot of raffles. And typically, if you bring a friend, you get an extra raffle ticket. And then we have a lot of promos. The main thing that we do that is super unique, we started this maybe a year or two ago, but we do bank your dollars, where you can create like a bank where that money, it's basically whatever you put in, you kind of get an extra percentage. Okay. You can use that for anything. Okay. So instead of being like, oh, I want Botox 60 units, get some free. Instead of that, this is just a more simple way to do it. And that way, if someone comes in, they're like, okay, I know I'm going to want to get some treatments this year. I haven't decided exactly what I want to do, or maybe I haven't had my consult yet, or, to go over things. And that way it's open. Okay. Which is, I think, super helpful, and also takes the pressure off of that. And then we also have our reserve membership, which that's also a bank your dollar situation. So every month they're debited their account for however much they want to. Actually, I think it starts at $175, but it rolls over, and that can be used towards anything. Also, they get a certain percentage off as a member. We like to keep it simple and not complicated, because I was looking at different options for these memberships for years, and some of them are just, it's like a lot. And maybe it comes with stuff you don't even want.
Well, it's a nice way to, be able to save toward some services that you want, and you're, getting maybe a little extra perk in there, because you said there's like an added percentage that goes with it.
Yes. Yeah. They get a percentage off of retail, injectables, and laser treatments automatically as a member. Okay. And so they may show up for their neurotoxin appointment or BBL or facial. Maybe it's been 2 or 3 months since they've spent any money, and they're like, oh, you have, $400 or whatever it is banked. So this is going to go towards your treatment today. So maybe you owe nothing and you still have some left over, or maybe you just depending on what it is. And then they automatically, as a member, get all those discounts.
Okay. Awesome. Well, thank you so much for joining us today. It was so exciting just to learn more about you and your practice and how you got there. Can you tell us where we can find you for our listeners?
Yes. So we are right in the heart of Dallas, but we are just west of Inwood on West Lovers Lane, and in a little boutique cottage. And we have parking, our own parking lot in the back. It's on the corner of Lovers and Roper. So we are directly across from John Kane Photography, and Canary is also another fun neighbor. And right next to the Charleston Club, which is a new mahjong lounge.
I keep hearing about that.
It's so cute.
I need to check that out. And and also, where can we find you online and on social media?
Yes. So our social media for Instagram, it's at Abbott Aesthetics, and it's ABBOTT. So 2 B's and 2 T's. Our website is www.drabbott.com, but doctor is spelled out.
Okay. Okay. Awesome. And we will put all those links in the show notes. And thanks again for joining us.